In this video we'll be discussing how to handle a nosebleed, a common issue that can be uncomfortable but is usually easy to manage with the right steps. Nosebleeds, also known as epistaxis, can happen for a variety of reasons. Some common causes include dry air, allergies, colds, sinus infections, or even minor trauma to the nose. While they're often not serious, knowing how to properly manage a nosebleed is important. 1. Stay calm and sit up straight. The first thing to do when you experience a nosebleed is to stay calm. It's important not to panic, as this will help you focus on stopping the bleeding effectively. Sit down in a comfortable position and avoid tilting your head back. Keeping your head slightly forward will prevent blood from flowing down your throat, which could lead to swallowing blood or even choking. 2. Pinch your nostrils. Now, take your thumb and index finger and pinch your nostrils together just below the bony part of your nose. Apply firm but gentle pressure for about 10 to 15 minutes. This will help stop the bleeding by putting pressure on the blood vessels inside your nose. While pinching, breathe through your mouth, and resist the urge to check by releasing your nose prematurely. 3. Apply a cold compress. If you want to reduce swelling and help slow the bleeding further, you can apply a cold compress to the back of your neck or the bridge of your nose. The cold will constrict blood vessels, which might help reduce the bleeding. Make sure the cold compress is wrapped in a cloth to protect your skin from the direct cold. 4. After the bleeding stops. Once the bleeding stops, avoid blowing your nose for at least 12 hours, as this can trigger another nosebleed. You may want to keep your nasal passages moist using a saline spray or a humidifier if the air is dry. Also, try not to pick your nose or scratch the inside of your nose, as these actions can cause bleeding to start again. 5. Preventing future nosebleeds. To prevent future nosebleeds, try to keep your nasal passages moist, especially if you live in a dry climate. A saline nasal spray is an easy and effective way to keep your nose hydrated. Make sure to drink plenty of water, and consider using a humidifier at night to add moisture to the air. This is especially helpful during winter months when the air tends to be drier. 6. When to seek medical attention. While most nosebleeds can be treated at home, there are situations where you should seek medical help. If the bleeding lasts for more than 20 minutes despite applying pressure, or if you experience frequent nosebleeds without any clear cause, it's time to consult a doctor. Other signs to look out for include heavy blood loss or if the nosebleed follows a serious injury. In these cases, seek emergency care immediately. Thank you for watching. We hope this video helped you understand how to properly manage a nosebleed. Like this video if you found it helpful, and subscribe to our channel for more health tips and advice.